think what Mr. McCoy said there is exactly right. Improving the quality of life of everybody in our community. And that's what all of you, all of our staff does here every day. And I love this time of year. I love National Rehabilitation Week because we get to recognize two of the most important groups to us. Our staff, our therapists, our front office staff, our aides that help us provide care, and our patients. Because that's what's so cool about rehabilitation, I think, is that it's a partnership. We can't achieve anything as therapists without you guys and without you all as families as well. It's a true partnership, and it takes the skills of the therapist to know what to do, when to do it, how to do it, and in what order to do it, but it also takes the skills and motivation of a patient and their families to actually bring that all to fruition. So that's why we do a Patient of the Year. We don't just sit around and pat each other on the back as therapists and go, great job, great job, great job, although we do that too. But we want to recognize this partnership because we can't achieve what we achieve without recognizing that partnership. And so we like to recognize our Patients of the Year because you guys were great examples of people who have very difficult situations. You know, I was talking to Mr. Rosman. He was in the hospital in long-term care. He said a total of 109 days.
That's that's
total.
79.
Sorry, Mr. Horvat. Yeah, sorry about that.
I can be Mr. Rodman.
So 109 days. You know, Thanksgiving, Christmas, New Year's, and even his 50th high school reunion. So you know that takes a lot of dedication. How many of us would hang out for 109 days in an inpatient setting? You know, we work here every day, but we probably wouldn't be the best patients. So, but it takes that dedication to achieve what you've achieved. So, again, part of today is to recognize you and that partnership, but also everybody else in this room. Just be thinking about the impact that you have every single day. You know, these are two of our star pupils here, but we have a lot of star pupils. You guys change people's lives every day. You know, I think that's why we have such a great group here. I think that's why everybody's so upbeat, everybody's so excited. Because we know when we get out of bed in the morning, we get to do great things. We get to change people's lives and help them achieve things that either maybe they didn't think they could achieve or maybe they've been told they can't achieve those anymore. And we take that as a challenge to say, no way. We're going to make sure you can do that. We're going to do everything we possibly can to get you back to what you want to be doing. And so today we want to recognize the two of you and all that you've achieved with the help of some of the people here in this room and representing all the patients that we've worked with over the past year and all that everybody else has done in the care of those people. So with that, we'd like to get to know you guys a little bit better. So your care teams are here to give a little information about you and educate us kind of what has gone on with your care and who they are. So we'll start with Mr. Horvat, and this is Beth Foster, one of our occupational therapists on the inpatient side. So take it away, Beth.
Pardon me, I'm going to read off my script because as I've traveled down this journey with Joe and just reminiscing on this journey of rehab with him, I just wasn't sure if I'd be able to hold myself together without having a script to recount this journey that I've traveled on with him. Joe was admitted to our hospital almost exactly a year ago. He was admitted in September of 2013. He underwent, during his stay, an emergent open heart surgery. He stayed at our hospital until December of 2013, a total of 79 days. After his initial surgery, he underwent 3 additional surgeries. Therapy began working with Joe in the intensive care unit. At that time, he required a lot of assistance, and the bed had to help him do the work of just sitting up. Joe progressed with being able to eventually sit unsupported at the edge of the bed, began assisting with his own self-cares, and eventually walking. During his hospitalization, Joe's wife was by his side. These challenges that Joe and Sandy faced weren't entirely new to them. Previous to this, Joe had had a stroke that required long-term acute care and a rehab stay. And Joe and Sandy's motivation and positive outlook are what carried them through all of these challenges, not once, but twice. Joe's family and friends were a huge support during his recovery. All of the healthcare team feel honored to have been able to care for Joe, and I'm so honored to introduce you to Joe Horvat.
Thank you, Beth.
Absolutely.
We just did the presentation for Mr. Horvat. We'd like to present you with a few gifts from us. to again recognize you and all that you've achieved, and for being one of our Patients of the Year. And this is a certificate for I'll call you Joe. So
Okay, that's good.
I've already been told don't use the Mr. word. So so this just says Rehabilitation Patient of the Year 2014 Certificate of Achievement awarded to Joe Horvat for his positive attitude and hard work ethic throughout the rehabilitation process. Thank you for your strong dedication to reaching your goals and allowing us to participate in the process.
Well, very nice. Thank you.
Sure. Thank you. Is there anything you'd like to say?
Yeah, you help me up a little bit.
All right.
There we go.
You know, I have to have a gate belt on. You're done with gate belts, huh?
I hope I never see another gate belt the rest of my life. But to all the professionals here, I can't tell you, because I've gone through a lot of rehabilitation, and with professional people like yourselves. Hager House had some people there. At Lakeview Village, I went to, after my stroke, a lot of rehabilitation. And they're the ones that first taught me how to walk. That was a real thrill. And I had home health care. I've gotten a lot of rehabilitation. But one thing is constant that I remember, I'll always remember, the professionalism of everybody. And I think you guys, I know the ones I've worked with or worked with me, but all of you are very professional in your attitude and your professionalism. But I'd like to give you a hand for bringing me back from the brink.
Thank you.
Thank you.
And then I believe Amy Nichols, one of our physical therapists, is going to talk to you about Richard.
Yes. So I have the pleasure of introducing Richard Rosman here. Some of you may know him. He's been a patient of the Rehab place in the past from different orthopedic reasons over the years. This year included Richard's most extensive therapy to date. He had a fall in February of this year, which resulted in a subdural and subarachnoid hemorrhage. He was hospitalized following his fall, and during his rehabilitation was hindered by pneumonia, sepsis, renal complications, and a new diagnosis of Parkinson's disease. With that being said, his first couple weeks here in therapy were pretty rough. He started April 9th here with occupational therapy and physical therapy. He was seen by Janice Miller and Amy Ellis for OT, and then by Sue, April, and myself for PT. When Richard started, he had dizziness, severe muscle weakness, and fatigue that limited his mobility and made it difficult for him to complete some of the basic neurological standardized tests that I was wanting him to start with. Over the course of his therapy, his mobility continued to improve through hard work, dedication by him and his spouse, and his optimistic attitude. April successfully treated his dizziness early on in his therapy, and by the time Richard completed his therapy sessions in July, he had improved. I wrote down some of the stats because I think they're remarkable as a neurological physical therapist. So the first test that I had to try for him to do was to stand up from a chair 5 times. It took him over 2 minutes to complete 2 times his very first try at it. By the time he was done, he was able to go from sitting to standing 5 times in 32 seconds. Wow. Pretty amazing. His 6-minute walk test to begin with. We walked for 6 minutes in the hall and see how far he can walk. He wasn't able to complete that, had to sit down for most of the 6 minutes. Midway through, he was able to complete 200 feet, and by the end was able to complete 355 feet during the 6-minute walk test. And then another test was the timed up and go. He improved from 42 to 18 seconds, which is a huge improvement for decreasing his risk of falls in the future. He worked especially hard this year, and I'm just so happy to have worked with him on this journey. I also have a few words from Janice Miller, who's at a continuing education class and was unable to be here today. Janice writes that Richard has to be the most optimistic man. When asked how he is, a typical reply is, "I'm good, but I'll get better." It's always great to have that optimism and then see a patient go from being dependent to independent. She states that after his fall, he came into the clinic with his wife being a part of therapy, and family involvement is so essential. His goal was to become stronger so he could be independent in this house and his wife could return to work. It's been a pleasure to see him graduate from therapy with increased strength and activity function and to be able to stay home independently. She writes, Mr. Rosman, thank you so much for your optimistic attitude, hard work, and continuing your home programs, which allowed you to meet your goals. You're so lucky to have a supportive wife. Truly, you are a great person with a great recovery.
Thanks, Amy. We wanted to present you with your goodies as well here. So your plaque is the same as his, except got a different name on it. But the same thing: positive attitude, hard work ethic through the rehabilitation process. I especially like that phrase that you said when you come in the room. I'm good, but I'm going to get better. That's a great motto for all of our patients. We need to teach everybody that. So you want to say something?
Sure. I just have a few notes here. I was given a couple names of people that I haven't paid off yet for voting for me. There's a great staff here. I'm just really pleased. And, they helped me come a long ways, and I really appreciate all the help. And I can't begin to name all the good people that are here, but you're here with one exception, I guess. But again, I thank you so very much, and just keep up the good work. And if you do this to everybody, it'll be one hell of a place to graduate from. Thanks again.
Again, I just want to thank everybody for not just being here today, but for everything that you do every day. You know, we've got some people that can't be here because they're at continuing education workshops today, just to improve their skills so that we can continue to treat people better in the future. Everybody goes to a lot of education. We're never comfortable sitting still, so I applaud all of you, all of our staff, for that continued motivation all throughout your career. You know, one thing interesting with Richard's story is the fact that we had a specialist in our outpatient clinic in vestibular rehabilitation that was able to get involved real quick, because that could have been a big stumbling block for him to eventually achieve his results. So we've got multiple specialties here that we don't have to refer out for. We can provide those services here and get everybody through their entire rehab program in one spot. So we sure appreciate all of our specialists, all of the therapists up on the inpatient units, all the therapists in all of our outpatient clinics, and all that you do every day, and all that you will do into the future. So we've got till 2:30. So I encourage you to go up and meet our patients of the year. If you haven't already, talk to them and their families. We've got refreshments in the back, so get a little something to eat, a little something to drink, and let's talk about the great things that we do in rehab. Thanks again, everybody. That was pretty good.
That was funny.
Joe, congratulations. Thank you. Thanks for coming.
Hi, sweetie. How are you? Thank you for coming. That's so nice.
Hey, how you doing?
This is Jay. Margaret.
Hi, how are you, man?
A good friend. And my cousin's husband.
I'm a
Kathy
dotted
Schwartz.
line cousin.
Hey, Don.